Initiative for Health Accountability and Transparency welcome you to CPD Academy Health Facility Management course, Module 2, which is on managing health resources. CPD Academy is the learning hub for health professionals. My name is Dr. MJ Abdullahi. I am your instructor for this course on health facility management. CPD program on health facility management is made up of two modules. The Module 1 is on management functions in health facilities, while the Module 2 is on management of health resources. This particular module is Module 2. The course materials include a graded pre-test quiz, which all participants must take before they proceed. There is also the video, the downloadable PowerPoint presentation which provides more details. There is also a graded course completion examination, and there are suggested resources on health facility management. Those who choose to have course completion certificate or CMA credits will need to achieve 75% pass and pay a token fees. The module is on management of health resources. Let us look at an outline of the presentation. We'll discuss about the types of health resources, management of health resources, and focus primarily on some resources for health, beginning with human resources, physical infrastructure, essential drugs, finance, equipment and logistics, time and space, and finally we'll also be speaking on health information and draw a brief conclusion. Looking at the learning objectives, the participants will be able to discuss different types of health resources and will also understand proper management of health resources for effective and efficient service delivery. Provision of health resources involves putting together different types of resources to deliver a range of services. Most of the resources are expensive and in short supply. Therefore, effective healthcare will require proper management of the available resources. Health facility managers and management teams need to have good capacity and capability of managing available resources. Let us look at the different types of resources that are required for effective and efficient delivery of health services. And these include human resources, physical infrastructure, you need finance, you need equipment and logistics, you need time and space, and you also need health information and proper documentation. Let us take these resources one by one, and beginning with management of human resources. Human resources constitute one of the most important resources in health on account of its costs and also its ability to mobilize and manage other resources. Let's take a brainstorming session on health facility managers' responsibilities. Take few seconds and note down some responsibility of health facility managers in human resource management. This diagram shows some of the responsibility of health facility managers. It begins with job induction and orientation. Also have job descriptions, promoting staff motivation, communicating effectively, doing effective supervision, providing continuing education, and also coordinating various activities in the health center. Let us take these responsibilities one by one. We begin with job induction and orientation. Job orientation is familiarization of a health worker to his duties and working environment. This is an important function of health facility manager. Norms and standards that translate health objectives and targets of health center is provided during this exercise. Let us look at the second responsibility, which has to do with providing job description. Every employee should be provided with a job description which states clearly what each worker is expected to do and prevent arguments on who should do what. We also have coordinating activities, which helps to bring activities into proper relation with each other and to avoid duplication by distribution of authority, providing the channels of communication, and arranging work to be done in the right way. Another responsibility is with communication. Communication refers to the process of relaying messages in a way that is effective and resulting in a response. It is important for managers to understand the different types of communication flow and channels. We have vertical, we also have horizontal. We also have conducting regular meetings as another responsibility. At meetings, services and programs running in the facilities and community are discussed and recommendations made for future actions. It also provides an opportunity to deliver new information on policy issues and plan, and also discuss welfare issues and clear misunderstanding among team members. There is the responsibility of promoting staff motivation. This refers to factors which encourage personnel to put in their best performance, and they include salary, working conditions, conducive environment, opportunities for self-improvement, among others. Performance appraisal is another function of the health facility managers. Staff performance is appraised in order that the staff may learn from experience and therefore improve or maintain satisfactory levels of performance. Its purpose is to identify employees' current levels of job performance and contribution, as well as strengths and weaknesses. Supervision. Supervision refers to an activity of more experience on higher positioned personnel, whereby they support the work of their juniors so that it meets set standards. It also aims at encouraging team members to apply their ability and energy to work. There is the continuing education. It is the responsibility of health facility manager to ensure the personnel are part of the supervising levels plan for continuing education for various health cadres. One of the key responsibilities of health facility managers is managing interpersonal conflict, which is common in many organizations. The mixture of personnel within an organization leads to differences in values, expectations, attitudes, and interests, which invariably creates a fertile ground for conflict. Potential sources of conflict include different values and interests of the people, antagonistic roles of different people, and also communication breakdown. How do you resolve conflicts? When you resolve conflicts, you can do that by use of authority, that is, the use of legitimate power to bring about compliance, or compromise, bargaining and splitting the differences so that everybody involved will be happy. Or there is also the third-party intervention, which is the use of a neutral actor as a mediator. In order to manage interpersonal conflicts, you need problem-solving skills, and we have earlier done a course on problem-solving and decision-making. You may wish to refer back to this course for more understanding. Problem-solving skills is required to manage interpersonal conflict, and it is a step-by-step process that proceeds as follows. You define the problem or issue to be addressed, analyze the issues, and generate alternative courses of action, evaluate the alternatives and select the best course of action, and implement the decision, or you select alternative, and then you monitor the results and evaluate the impact. Like I said earlier, details on this course are available in our previous courses. There's issue of discipline as a responsibility that often stare health facility managers frequently. Health facilities should have a code of disciplinary procedures, and all staff should be familiar with guidelines on disciplinary procedures, and in order to ensure fairness and order in processing disciplinary cases, there should be a disciplinary committee which will be given responsibility of looking into disciplinary cases. Let me emphasize here that once there is an existence of code of disciplinary procedures, it is important that the facility managers or the supervisory level adhere strictly to this to ensure compliance with due process. Let's take a feedback. Did you correctly note down at least 5 responsibilities of health facility managers in health resources management? If you are not clear about some of these responsibilities, you may once again wish to revert back to some of the earlier slides that dealt with this subject matter. Let us look at another resources that are required in health centers, and this is physical infrastructure. Conditions of healthcare facilities have profound impact on service utilization, on healthcare generally, patient satisfaction, and health outcomes. Because of poor physical infrastructure, many patients bypass primary healthcare facilities and head for secondary and tertiary level cares. Maintenance of physical infrastructure should be a key factor in management of a health facility. Facility managers should ensure appropriate maintenance plan is prepared and is funding incorporated into annual budgets. Materials and items that would require a minimum of maintenance should be maintained by simple possible means using locally available funds to avoid long delay and further deterioration. Maintenance that will require procurement and service contracts should be included in the yearly maintenance and service budget. Problems of maintenance should be anticipated and mechanisms put in place to cater for them in the following ways. Identify key problems of physical infrastructure in the facility. Describe the basic information necessary to guide physical infrastructure priority setting, and then develop annual maintenance plan and describe the types of maintenance and the key elements of the problem faced in health facility. Much of the maintenance required for health facilities, particularly in rural areas, can be done using basic level skills and requiring few material. There is the need for establishment of an effective system for dealing with simple routine maintenance through a team of maintenance workers, which should be initiated at the supervisory level. Health facility management should engage LGA workshops and maintenance stores where possible for health facility maintenance. Facility management should prevail on maintenance team to prepare the documentation on which maintenance planning can be based. This will include the following: a list of all preventive maintenance jobs which have to be undertaken every day, week, month, or year, and a list of tools and equipment required to carry out the repair and maintenance activities which have been described. A work program and schedule allocating the tasks to the maintenance staff is also very important. Let's not forget prompt documentation of information regarding breakdowns and need for maintenance. Let us take Section 3, which deals with management of essential drugs. Drugs are a special resource that require proper management. If not properly managed, drugs can be pilfered or stolen. Essential drugs are those that satisfy the healthcare needs of the majority of the population. They should be available at all times in adequate amounts and in the required dosage forms. They are identified by generic name and usually cheaper than the brand names or patent products. When drugs are out of stock, patients are unlikely to visit health facilities, not even for preventive advice. Let's note that all drugs can expire, and some, like vaccines, need special transport and storage conditions. Let us take a second brainstorming session, which is the objectives of drug management. Take few seconds and note down the objectives of drug management. Health facility managers must be very familiar with drug management processes, procedures, and practices. And it's important to first of all understand the objectives of drug management. Drugs and drug supply should be properly managed to ensure that they are available when and where needed, to ensure rational use of drugs through training, supervision of health workers, and educating the public and patients. And most importantly, but not the least, is to avoid wastage. Drugs are wasted at different stages of drug supply system, and there are many reasons for this. It begins usually with improper selection of drugs and ordering of wrong quantities of drugs, damage or theft during transportation, spoilage of drugs by wrong storage practices, wasteful and incorrect prescription, wasteful dispensing, poor explanation to the patient during dispensing, and also poor use of drugs itself by the patients. Others include wasteful and incorrect prescription, which is very, very common. And that is why we'll often talk about rational use of drugs. Often, too many drugs are prescribed for one patient encounter. Expensive brand names are still used instead of recommended generic names. It is important for health facility managers to note this and ensure compliance on the use of generic drugs. Drugs sometimes are prescribed without proper diagnosis, and antibiotics and injections are still overprescribed even when the dangers of such a practice are known, such as problems related with resistance and even transmission of diseases. Taking a feedback on brainstorming session, did you correctly note down the objectives of drug management? If you do not, you may wish to revert back to the slides that deal with these issues and for you to get better understanding. Now, looking at rational drug use, this is a term that is common. Drugs should be selected, procured, and dispensed in order to be correctly used. A correct diagnosis, rational prescribing, correct dispensing of drugs, and good patient compliance lead to their rational use. For safe, effective, and prudent use of essential drugs, correct dispensing and labeling should be done. Reliable information about drugs should be made available to the patients. It is important for health facility managers to ensure that these guidelines are strictly adhered to so as to ensure rational drug use. As part of management of essential drugs, we often have to deal with drug distribution. Health facility management need to be aware of prevailing drug distribution system. And we all know there is central distribution, which means that an organization is charged with responsibility of procuring drugs and then selling or distributing to public facilities. The supervisory level for primary healthcare is the LGA level, and quite often a local government level does central distribution. However, in a decentralized procurement and distribution system, there are stores at different levels which make bulk procurement of drugs and later sell them to public or other health institutions. There is also the private sector distribution system involving individual organizations allowed to procure drugs and sell them to institutions and the public. The drug management tools such as stock cards, delivery forms, bin cards should be used in order to keep track of the drug movement and to keep accurate records. Let's not forget that regularly filled stock cards can help the teams to know, among other things, when to pass orders based on data such as average monthly consumption, safety stock levels, lead time, losses, or adjustments. It is important for health facility managers to clearly understand how to calculate drug requirements. And there are two main methods of estimating drug requirements. We have the morbidity method, which estimates the need for specific drugs based on expected number of attendees or attendances, the incidence of common diseases, and standard treatment patterns for diseases. It depends on availability and reliability of morbidity data. There is also the adjusted consumption method, which starts from existing consumption of drugs concerned and then assumes that the same amount is needed, states quantity required, dosage form, and also the strength. Let us note that in calculating drug requirements, that ordering too many drugs is wasteful. And we have also mentioned earlier different ways in which wastages can occur. Drugs occupy storage, and there is a risk that they will expire before use if you do not calculate drug requirement appropriately. Ordering too few drugs will cause patients to suffer because they cannot be treated. It is important to ensure that health facilities have adequate supply to treat the caseload of patients that they have. Another aspect of management of essential drugs is ordering and receiving drug kits. Health facility managers have the responsibility on the proper procedure for ordering, for receiving, and inspecting the drug kits. This has advantage because the system is easy to operate. It also has disadvantage because the contents of the kit is standard. You may therefore not receive some drugs that you need while remaining with excess drugs that are not required by you. The kit should be received in the presence of recognized community representative and inspected to see if intact or for any signs of tampering. Items in the kit should be entered on the ledger book. Stocking and storing of drugs is another important aspect of drug management. Drugs should be stored in an orderly manner and recorded in a stock ledger or bin cards. Drugs should be kept in a cupboard, dry and cool and away from light. Keep tablets in airtight tins or jars and clearly label each container. Clearly mark all containers with drugs that will expire this year to ensure that they are used first. When storing and using drugs, remember the FIFO and FIFO principles. FIFO, first in, first out. That is, first use the drugs that first went into the cupboard. Most of these drugs are the ones that are likely to expire early. And there is also the FIFO, first expire, first out, which I have just mentioned. Dangerous drugs should be kept in a separate double-lock cupboard with special issuing register issued by the supervisory level. Record issuing of drugs on the bin cards and stock ledgers as required. Calculate the remaining balance and check against what remains on the shelf. In this way, you can notice when you need to order new stocks. Also, check drug use against patient treatment requirements and also be aware of discrepancies and change in drug use. It is also important to consider educating staff on the use of drugs. It is very important that all staff are educated on the importance and use of drugs as well as the way to handle them. It is important to regularly discuss standard treatments for common conditions in clinical and therapeutic meetings in health facilities. The standard treatment guidelines should be available in every prescriber's office, and make sure that the common standard treatment are clearly displayed on wallboards, and all staff should know about the cost of drugs. There is also need to educate patients and the public about drugs. Patients may demand specific treatment even when this is not in their interest. We know commonly people will ask for injections and antibiotics. Health workers need to have persuasive skills in order to educate and convince the patient on what type of treatment or drug is best for them. Stock management and control system is very, very important in drug management. Proper stock management of drugs require that we have stock tools such as the stock cards, stock books, order books, etc. With good stock management over a good period of time, it is possible to determine the quantity of drugs to be ordered each time an order is placed, which mostly is on a monthly basis. Taking into consideration the delay that might occur from time to time with medical supplies, it is also possible to calculate minimum stock for each item. This will allow you to order ahead of depletion of some of these drugs. There is what we call minimum stock level, which is the amount of an item that is required over a period of 3 months. When the minimum stock is ordered, there are hardly any supply problems if the deliveries are constant. On receiving the orders, all the items are entered in the stock card and the FIFO and FEFO rules are applied accordingly. We've already mentioned about these acronyms and what they stand for. Disposal of expired and unused drugs is very, very important. Expired drugs and drugs that have been dispensed but remain unused have to be destroyed. Following government financial orders and store regulations is very important to ensure accountability. This is necessary because it is not ethical or rational to dispense drugs of questionable quality, and destruction is necessary to remove the temptation to use unfit drugs. It is important that we promote prescription of generic drugs. A useful tool to promote generic prescription is through preparation of a set of 2 alphabetical lists of all commonly prescribed drugs. 1. Listing generic names with the commonly used brand names, and the other is listing brand names with their generic name equivalents. This will help practitioners to recall generic names when prescribing. Section 4 of this course deals with management of finances. Finances are among the most important resources of health services, and managing finances in a health facility can be complex and a responsible work. It is done mainly by finance clerks, finance officers, or accountants. However, the health facility managers and heads must be familiar with some of this process because they take responsibility for infractions in financial management. Keeping account records accurately, up to date, and adhering to financial regulations at all times is a major task of the accounts unit. At all levels, it is important to maintain proper accounting records and documentation. Let us take a third brainstorming session, and this session is on sources of funds. Take a few seconds and note down sources from which health facilities can receive funds for recurrent and development activities. A health facility can receive funds for recurrent and development activities from different sources. We have the user fees charges, health insurance capitation user fees for those facilities that are accredited by National Health Insurance Scheme or State Social Health Insurance Scheme. We have government, which does fund allocation, which can be in many ways. There are also donors and private donations that can make funds available for management of health facilities. Whatever is the source, all funds need to be properly recorded and managed using financial and accounting documents and books. Did you correctly note down any of the sources of funds for health facilities? Let us look at user fees. Many healthcare facilities are engaged in a system of financing in which users of health services pay for the use of health services. However, since the introduction of the user fee system, a number of problems have been noted. For example, user fees is recognized as a barrier to utilization of services by the poor. And there is also the issue of poor systems of collection, safety, and use of such funds. And thirdly, there is the issue of thefts and poor money accounting system. Accounting of user fees. We need to establish proper user fees from collection, its use, and accounting systems that will ensure maximum collection and benefit from the scheme. All collected patient fees should be recorded in OPD, that is outpatient department, and inpatient registers as the case may be. All patients who pay fees should be issued an official receipt. The original is given to the patient and the duplicate is kept in the receipt book. At the end of the day, all medical fees collected should be added up and reconciled against receipts issued on the day, and this should balance. The use of the fees raised by the health facility is determined and governed by government financial regulations. It is important. In some facilities, the money that is received can be expended, or specific percentage can be expended, and the balance will have to be paid to the treasury. In some others, all that is collected has to be paid into government treasury. Another source is health insurance, which is becoming very important today. Some health facilities are accredited as providers of healthcare under the health insurance scheme, and they receive capitation for services rendered to enrollees. Such funds should be managed as provided under the insurance scheme guidelines. There is also the fund allocation. Cash can be advanced to a health facility mostly as interest in government-owned facilities or even some private facilities to spend for running of the health facility. Advance of large sums of money to a health unit should be deposited in a bank. However, where small amounts of money are needed, the petty cash system is used. Donors and private donations constitute another source of fund for health facility. Developing partners through grants, the communities and private individuals also contribute significantly to health facility funding in some instances. Such funds should be managed in accordance with guidelines established by those who provide the funds. Let us take feedback. Did you correctly note down any of the sources of funds for health facilities? You may also wish to revert back to the slides that discuss these issues for more understanding. The health facility management has some responsibilities in financing. We have highlighted some of them along the way, but it is important to note that some of these responsibilities include identifying different sources of financing for the health facility, proper accounting procedures, maintaining proper accounting and financial records, and also be familiar with different financial documents like the ledgers, cash book, receipts, issue vouchers, payment vouchers, and invoices, and how and when to use them. It is important to be familiar with account booking and financing reporting. The list below provides the main accounting document and records which are used in accounting. We have the general voucher. We also have general allowance claim form. There is also the impress request retirement voucher. And let's not forget the cash reconciliation sheet. Others include final financial reports and also the income register, which is used to record all income received, cash or checks. Accounting for money. We need to understand the procedure of accounting and also for stores documentation. All transactions in accounting and stores should be in writing using financial documents like the ledgers, vote book, receipts, delivery notes, issue vouchers, payment vouchers, LPOs, and invoices. All payments received, whether from patient or donors, should be recorded and acknowledged by recipients, whereby a carbon copy should remain in the receipt book. A secure safe box should be available in each health facility to keep collected user fees for banking. Keeping allocations ledger is very important. The allocation of visible cash may be granted either monthly, quarterly, or annually. When the amount is granted, the date, the purpose, and the amount are recorded in the allocation ledger book. The reference number of the document that confirms the grant of the money is written in the column headed Document Reference Folio Number. This ensures that the original document can be found again when necessary. It is very important to adhere to all these three listed points on keeping allocations ledger. Using petty cash impress system or spending visible money is also common in health facilities. Petty cash means a small amount of money set aside for small purchases. Most workplaces find it convenient to have some petty cash. Petty cash is advanced to the health worker to buy or pay for necessary small items needed in a health facility. We're now going to section 5, which deals with management of equipment and logistics. Equipment and logistics are among the critical resources required at our health facilities. Hence, they need to be managed appropriately. Management of logistics involves selecting, ordering, storing, issuing, and keeping of inventories. It includes management of stores and maintenance and repairs of equipment. There are two types of logistics system. We have the allocation or a push system, where higher level facility decides what commodities move down and when, and pushes them down through the system. We also have the requisition or the pull system, where the lower level facility orders commodities when it needs to, thus pulling supplies through the system. It is important to note that the decision to use either a pull or a push system is made based on the skills of management staff and availability of management information at all levels of health system. There are procedures that we need to adopt in management of equipment. The procedures in the management of equipment at health facilities are as follows. You order the equipment from stores. You need a stethoscope. You need a BP machine, or you need a weighing scale. Then there is the storing, recording, labeling, and holding equipment in a storeroom. You may have requested for 2 stethoscopes or 2 BP machines, but you need only 1. So you need to store the second one. Issue, giving out, recording the issue, balancing of remaining stock, and receiving a signal issue voucher is very important. Controlling, maintaining is also very important. And don't forget maintenance and repair. Include maintaining a logbook for each equipment. You also need to have a ledger book for consumable equipment and an asset register for non-consumable equipment. Every time an item is delivered, the quantity received is added to the total stock, and the resulting number is the balance in stock. The ledger will have following headings: the item, the date, received from, and then issued to, LPO number, quantity received, the quantity issued, and the balance in stock. This is very, very important for fairly medium-sized facilities. Another aspect that is very, very important in equipment and logistic management is inventory. Inventory is a list of items that are kept in a certain place. Each section, room, or the health facility should keep inventory register of all stores, and new supplies should be added to the list at all times. We need to also understand how to control for equipment, ensure that all consumable supplies are used carefully and that there is no wastage. Non-consumable supplies must be kept in good working condition. Use inspection checklists and inspection schedule to check on all equipment. Staff must be convinced on the need to keep equipment in good and clean condition. We have also mentioned the inspection checklist. Equipment that easily breaks down should be checked regularly. It is important to establish special regular inspection schedules and prepare an inspection checklist to facilitate this particular aspect of work. Let us look at maintenance of equipment. The maintenance of medical equipment is essential to ensure that they function correctly and efficiently, and ultimately to ensure proper clinical management of the patient. It is therefore important that adequate standards of maintenance are achieved. Maintenance of equipment may be carried out by health facility personnel employed to operate the instrument within a facility, or by technicians contracted specifically to carry out this work. The following steps are important for proper maintenance of equipment and vehicles. Operational manual of the equipment must be available. Maintenance schedule must be vigorously maintained. Maintenance should be carried out on preventive basis rather than after a breakdown. And also, a major breakdown can be a sign that the maintenance and servicing programs have failed. Let us look at the transport component of equipment and logistics management. Provision and operation of transport is the responsibility of LGA PAC management team. However, depending on the scope of operations, health facility management may require reliable transport system to carry out some of its programs. Transport management involves proper handling and effective monitoring of the use of vehicles and all other means of transport. There are various means of transport at the health facility. There could be motorcycles and motor vehicles which are commonly used. Depending on the scope of operation, health facility management may require motor vehicle to transport vaccines and cold chain equipment and ambulances for referral of patients. It is therefore the responsibility of health facility managers to ensure that transport needs of the health facilities, services and programs are met and funded as when necessary to enable effective service delivery. Transport which is provided is used effectively, safely and economically. Staff using the transport, particularly the motor vehicles and motorcycles, are properly trained, and also to ensure adherence to transport policies and procedures for use of official transport and vehicle parking overnight. Usually there are policies that govern use of official transport. Other responsibilities that health facility managers should be familiar with includes recommending vehicle replacement when necessary, approve weekly, monthly transport plan, plan vehicle servicing and maintenance, arranging vehicle repair, prepare transport budget, check accounts for fuel and servicing, monitoring and control, transport inventory, and transport schedules. These are all keys responsibilities that the head of facility should be familiar with. Let us look at managing time and space. Management of time and space has not received adequate attention as a resource. Consideration of these resources in the day-to-day running of health services will improve the efficiency of our interventions and the ability to achieve set targets. Proper use of space may also lead to savings and overall improvement in job performance. Let us begin by looking at managing time. Time is not often thought as a resource, and it is a non-renewable resource. Health workers need to be conscious of their clients' waiting times for services they offer and try as much as possible to minimize the waiting. So health workers need to be conscious of their clients' waiting times for services they offer and try as much as possible to minimize the waiting time. Time management in healthcare is concerned about two issues: how health staff spends time in a health service and planning the use of time in healthcare work using timetables, schedules, rosters, and also program charts. Time plans in a health facility. Events are arranged in daily, weekly, monthly, or yearly time periods depending on their frequency or regularity. Time plans are written in various common forms known as timetables, schedules, or programs. A health facility will need the following time plans. The first is a weekly timetable that shows the time of the week when certain regular events always take place, like staff meetings, daily consultations, etc. Several schedules showing the detailed days on which intermittent events occur and where they occur, e.g., visits to peripheral health units or mobile clinics. Several duty rosters for different sections of work, like night call, outpatient duties. Let's also not forget programs of any special health facility, like nutrition campaign, and also an annual overview of events. The time plans are variously known by different names. We have the timetable for daily, weekly, monthly, or regular reoccurring events. We have schedules, which are intermittent, irregular, or variable events, including details of where the events take place. We have rosters for duties planned for different staff members, and we also have programs for long-term arrangements of survey on different events or activities, of which the time plan is only one part. It is important to understand preparing a health unit timetable. All the activities that happen regularly each week should be listed and then arranged in an appropriate timetable grid according to local working hours as shown below. Health unit weekly activities and timetable. This is the list of regular activities and their frequency of occurrence. This is a typical example of a timetable. Another aspect of time plan is preparing a health unit schedule. A schedule is required when a different activity or the same activity in a different place occurs at intervals or over time. It is essential to have a calendar showing the dates of the chosen interval. We also have to understand preparing duty rosters. A duty roster is a time plan for distributing work among staff members in turn. Duty rosters are common in all types of health work. They are needed usually for three purposes. One is to distribute work fairly and evenly, and to distribute work equally among the various members of the unit, and also to divide extra duties between the whole staff. It is important to understand how to prepare duty rosters. Preparing a program chart. A program is a plan that outlines a series of events or activities that will take place in future. A program usually includes what will be done, where it will take place, who will do it, and when it will occur. The time plan is therefore only part of the total program. There is preparing a year calendar. In the course of a year, many things may happen that are outside the normal routine. To see the whole year at once, it is very convenient to have a one-page annual calendar or yearly planner pinned on the wall with important events marked. This has two functions. It acts as a reminder of definite events, usually outside one's control, and it also shows where it is possible to fit in new events such as special meetings or periods of travel. It is important to also understand managing space. Managing space is concerned with two kinds of space and how to make best use of them in providing healthcare: the buildings and settings where healthcare is given, and also the geographical or catchment area served by the district or the health facility. The first thing to look at when managing space is arranging workspace. Good management takes care in arranging the space where staff work or where materials are kept. The small size of the building or of individual rooms leaves little room for managers to organize space utilization, and this need to be adequately addressed. What work has to be done? Could this space be arranged in another way that could make the work easier? These are all questions that we need to answer if we are arranging workspace. Apart from arranging workspace, you also have to arrange the workflow. One of the features of many health units is lack of order in which people are dealt with while waiting to be attended. These problems can be improved by developing a smooth workflow. Workflow is an arrangement in which a series of work functions are coordinated in space and time so that delays are minimal. Let us look at specific examples of workflow. We begin by looking at workflow in an outpatient department. To organize the workflow in an outpatient department, each stage must be examined separately. If there is a queue, it is a sign that work speed or work efficiency must be improved, or that work distribution must be changed. It is essential to examine the whole process. We need to improve workflow. Good workflow has been achieved when each patient can go through each stage in an orderly manner with only a very short waiting time. The flow has some ways to avoid delays. Every door should be labeled so that patients know where to go. And also at registration, there should be registration points for review patients and for new patients. Review patients should be allowed to keep their cards or be given numbers by which their cards can be found rapidly. A workable filing system should be established by which record cards can be found rapidly. At the waiting station, based on the clinical presentation, a nurse should Let us look at the waiting station. Based on the clinical presentation, the health worker should screen patients so that patients presenting with serious conditions should be attended first. At the examination room, for best use of the examination room, patients returning daily for a course of treatment should go directly to the treatment room. Clinical days should be established for special conditions that require more time, e.g. tuberculosis, leprosy, and malnutrition. Appointments with busy officials should be made during times when they are less busy. In the pharmacy, a stock of written instructions to patients on how to take routine courses of drugs should be kept. Routine courses of drugs should be pre-packed. It is important for health facility managers to identify their catchment area. They need to know their geographical catchment area. This helps them to know the distribution of other health facilities and their service area and the communities. And this helps them to assess their performance in their working area. It is important to know the catchment area because it provides information on total population served, provides the basis for calculation of target population groups, allow better planning of outreach, mobile services, and home visiting, and also facilitates planning for community involvement so that it can cover all parts of the population. Let's not forget that maps are very important in health works. Maps can show the distance to various health units and villages and can further be used to plan routines and decide on the mode of transport to be used, learn about the population distribution and density of the area, and also learn about the different types of communities in the area. Let us look at the section 7 on management of health information. Information is an important resource in health management, and health facility management rely on both informal and formal sources of obtaining information in the healthcare delivery system to make rational decisions. Management of health information refers to the process of data collection, analysis, interpretation, utilization, and dissemination of such facility for decision making. Information management at points of collection and at LGA level is vital for improvement of performance of the health system. There are data management responsibilities at all levels. It is therefore important for health facility managers and teams at all levels to identify relevant sources for data collection based on the services delivered. At the facility level, data sources include routine healthcare records from designed forms and registers. Routine healthcare data compiled, analyzed, and examined carefully to come up with facts that can be used for decision making at the facility and also at the community. Analyzed data is called information and can be interpreted and the facts used for decision making. Simple mathematical comparisons using totals, averages, proportions, and percentages can be obtained. These help to visualize differences, trends, shortages, and excesses. They can also be used to compare with local and international standards. It should be emphasized that at the health facility level, the facility managers on their own should undertake data collation and presentation, and also interpretation, and use the facts for decision making at the facility level and also on the target communities. Simple mathematical comparisons, like we have said earlier, the visualization should be done at this level for their own use. Summarized data can be presented using simple tools which make it easier to visualize and understand better. This include frequency distribution table, line graphs, histograms, bars, and pie chart. You should recall that in one of our courses under monitoring and evaluation, we had done a course on data and health management information system. The analyzed data should be presented at health facility management meeting and also at the community and ward development committee meetings, and the findings discussed with them on how to solve the identified problems. Unfortunately, dissemination of information is often forgotten. Providing a feedback of information to the data providers is also very important to encourage them to continue to collect data. Of what use is information that is generated at health facility level? Information can be used to quantify health problems and needs, health-related problems, their distribution, determinants, and consequences. They can also be used to prioritize health problems and needs, select interventions, and develop plans, and also determine the size, distribution, and other characteristics of target population, both demographically and ecologically. Health information can also be used to quantify the type and distribution of remedial services to be undertaken, provide a baseline in planning for monitoring evaluation of the effect and impact of services on health status of the target communities, what should be done when establishing health management information system for a facility. It is also important health information is used to determine the catchment and service area and also calculate target populations. This will give you the denominator for each indicator. Let's draw a brief conclusion. Provision of health services involve putting together different types of resources to deliver a range of services. Most of the resources are expensive and in short supply. That means we will need to prioritize our interventions and services. Therefore, effective healthcare will require proper management of the available resources. Health facility managers and management teams need to be capable of managing available resources. Physical condition of health facility has profound impact on service utilization, healthcare, patient satisfaction, and outcomes. Therefore, maintenance of physical infrastructure should be a key factor in the management of health facilities. Drugs are also very important. They are special resources that require proper management. It is important that they should be available in adequate amounts and in the required dosage. Finances are equally important, and they are among the most important resources of health services. Managing finances in health facility can be complex and responsible work. It is done mainly by the finance clerks, finance officers, or accountants, but it is also important for head of facilities or facility managers to be acquainted with the processes and the procedures, knowing that they are the accounting officer. Equipment and logistics are key and among the critical resources required at our health facilities, hence they need to be properly managed. Information management at point of data collection and at the LGA level is vital for improvement of the performance of the health system. There are a number of resources for further reading on health facility management which you may wish to access, and you are encouraged to go beyond this list so that you will have a greater grasp and more skills and competencies in health facility management. Join our CPD Academy Learning Network. To ask questions, share ideas, and make comments, you can mail us at iheartnigeria@gmail.com.